I don't usually have to follow a speaker like Basil, and I've never really heard Basil speak before. He and I have known each other for a long time. He's been a marketing client of mine, and we've had many conversations. I know he's brilliant, but I think the presentation that you just heard is really one of the most dynamic, forward-thinking presentations I've ever heard. And I go to a lot of these kind of meetings. If I had to make an analogy, it's like at my uncle's funeral, when I followed the rabbi who had been his friend, rabbi, buddy for about 50 years. He spoke first, and I went on second. So anyway, gives you a little bit of an idea of how I feel. So with that as an intro, I want to try and get you more implant patients so you can use his guide, so that you can treat more people, become more profitable, and grow your practices. And the first thing I did is basically to interview you like I do at any meeting I speak at. And if I had to give percentages, I'd say it's pretty much of a bell curve. There's some of you who are busier, there's some of you who are flat, and there's some of you who are down. If I had to give a little trend line in terms of where, I'd say Toronto is a little more to the flat and down side, and I'd say the suburbs are a little more to the up or flat side. So that's a little bit of a trend line. So let's start off on an optimistic note. And you know, I don't think this study, which was done in U.S. News and World Report, is any much different than it is in Canada. You are still considered to be the top small business in the world, or at least in your country. And despite some of the difficulties you have, dentistry is still a great profession. We're still highly thought of. What's interesting, you don't see lawyers on this thing at all, and physicians are fifth and we're first. So that's got to be telling us something, okay? And this is from Bernie Stoltz. And Bernie Stoltz is one of these real upbeat, optimistic practice administration lecturer, and he has a company where they come into your office with this fortune management thing and try and help you out. Let's talk about what marketing is. And really, marketing is about everything you do. It's just not about advertising. Insurance participation, you really don't have that factor here. I think the Ontario province pretty much sets the fees, or maybe your plan pays for a portion of it. I don't think, from what I gather in speaking to Basil last night, that it's as important as it is in the United States. Certainly we want to be high tech. We want to have a wide menu of services. Our facility and location are important. A website. How many of you have a website? Hands up. Well, it's not everybody, and it should be everybody. And today, what happens when someone mentions your name, the first thing that happens is someone goes to the web to check you out. Usually it's the wife. And if you're not on the web, if you don't have a website, you're not perceived as being modern enough, or your practice is not perceived as being progressive enough. And you could have a 4.5 or 5-star rating, excuse the voice, but still not be considered modern or progressive enough. They're not going to get to that 4.5, 5 rating if they don't see a website. Okay, so I would encourage all of you who don't to do. What I believe is the best treatment for you. If you believe it, the patient will more likely follow. What you are, what you believe, why you believe it,